Hello everyone. Welcome to the presentation of Spirituality and Medicine, Friend or Foe. I wanted to start with an introduction about studies that have been conducted across America, which shows just how strong and spiritual the American people are. As you can see from this slide, studies were conducted in North Carolina, Texas, New York, and Massachusetts. And they show a very strong percentage of patients who are spiritual and religious. North Carolina, 65% of patients. Texas, 80%. New York, 66%, and Massachusetts, 73%. The data collected speaks for itself. Americans, as a people and as patients, have very strong spiritual and religious beliefs. A lot of times people wonder, what is spirituality, what is religion, and what is medicine? So I've included definitions. Basically, spirituality is how a person sees themselves and connects with those around them, and what's sacred. Religion is more of a organizational system or a belief system, and medicine is basically a science that's used to treat and cure the human body. Doctors in the medical profession, they use the ethical principle of do no harm. That's their main focal point. And sometimes the medical profession and doctors can be so focused that they sometimes forget to listen to the patient that they're treating. We as patients and we as people generally, we have the ethical principle of self-determination. In other words, we can decide for ourselves what's best for us, and that includes medical treatment. We can accept a doctor's medical treatment, we can reject the medical treatment, or we can accept part of it and reject the other part. Studies have shown that religious and spiritual beliefs lead in the decision-making process, not only in our daily lives, but also in our concerns with medicine. One of the problems that occurs is that when doctors and patients disagree with their treatment plan, especially when it's based on spiritual or religious beliefs, doctors are somewhat afraid to inquire or ask, what is the patient's belief? Physicians cite things that they're uncomfortable, that they don't have the time, or that they don't think that spiritual, religious questions or beliefs are their responsibility. However, when doctors have been surveyed, they have found that doctors, somewhere between 85 to 90%, feel that they should know their patients' religious or spiritual beliefs. And again, there have been studies conducted across the United States, specifically studying whether patients want their doctors to know their spiritual or religious beliefs. And as you can see by the results, a lot of patients do. They want their patients want their doctors to know. And they want to have those kind of discussions with their doctors. Also, what was interesting is that some of these patients even wanted their doctors to pray with them. And the numbers support this. Again, other studies have been conducted that show similar results. So how do we measure spirituality? How do we make it evidence-based? And again, within the last 2 decades, studies have been conducted that actually have measured the outcome of quality of life, of utilization of outcomes, and satisfaction of care. A study conducted by Brady in 1990 measured quality of care and showed that patients that have a high spiritual or religious belief actually have improved quality of life, better life scores than patients that had little to no spiritual or religious belief. Other studies were conducted, one following cancer patients through death, supported and showed similar results. Measurement of satisfaction of care. University of Chicago Hospital and Duke University Medical Center conducted studies with their patient population, showing that when the medical staff, particularly doctors, refuse to talk about a patient's spiritual or religious beliefs, these patients had a negative satisfaction of care. They felt that something was missing. Now keep in mind that both these studies did not prove causation, but it left the door open for continual research to be conducted concerning this area. So why does medicine neglect spirituality? Even though we've had studies that show the impact of spirituality and religious beliefs on patient outcome and quality of life, you would think that the medical profession would open their arms and embrace spirituality, but that's not happening. And one of the biggest causes is because of how doctors are trained, and it begins in medical school. There are 5 key factors that reinforce the separation of medicine and spirituality, which is what I went through here on this particular slide. And some highlights are basically, hospitals or institutions. They're institutions of technology and care. Hospitals don't view themselves as being institutions of humanistic care. Physicians are trained to be scientists, to know how the body works so that they can put it back together so they can heal it. And secondly, they are the health managers. They don't really see themselves as healers of the whole person. They're just healers of the body. A lot a lot of people believe that physical health and death are not connected to spiritual forces. It's like some kind of hocus pocus going on. And they don't believe in that. They believe in the science. You know, the engagement of fear and death are best talked about or dealt with by the clergy and the religious community, especially questions about what happens after death. And basically, contemporary medicine is a business. And many believe that spirituality and religion, even though religion is a business unto itself, it doesn't belong in the healthcare system. In recent decades, holistic medicine has pushed its way to the front. And a lot of patients and a lot of people have gravitated toward holistic medicine because the philosophy of holistic medicine, they seek to treat the whole person, not just the body. And in this way, holistic medicine really kind of resembles the traditional Chinese medicine, because traditional Chinese medicine believed in the same thing, treating the whole person through mind, spirit, and body. Holistic medicine uses a 4-point focal point: the physical, the mental, the spiritual, and the social as its form of treatment. That's the core beliefs of holistic medicine. And I think this is what really draws people to it so much, because it's about the whole person. In my opinion, I believe that what makes me me is important. That I'm not just a body. My beliefs are what define me. It makes me who I am. It makes my existence important. And I think that medicine and spiritual beliefs or religious beliefs, or whatever you want to call it, go hand in hand. And it's been proven scientifically through studies and through data collection that spirituality, religious beliefs directly improve patient outcomes and quality of life. Not only, in a hospital healthcare setting, but also in everyday life. I also believe that if doctors were trained to look at the whole person, to listen to our beliefs, and not be affronted when a doctor presents their best treatment to us and we reject it because it doesn't fit within our beliefs, and they take us to court to try to get the courts involved in healthcare. I think that's wrong. I really do. I think that practicing doing no harm and also respecting a patient's autonomy, a patient's belief system, that is when you present the best treatment plan. And even if a patient rejects sound medical advice, that is still a very viable treatment plan to that patient. My belief is that you can't take my body without taking who I am as a person along with it. We're a package deal. You have to treat all of me. During my research, I found this statement by Viktor Frankl, a psychiatrist and Holocaust survivor, and it really struck a chord with me because what he had to say, I think he said it the best way possible. Man is not destroyed by suffering. He is destroyed by suffering without meaning. Thank you all for my presentation. Stay safe and stay healthy.